Deborah, thank you so much for giving up your time to speak to us today. It would be really nice to start if you could just introduce yourself and tell us a little bit about what you do in your day job.
Yeah, sure. I'm Deborah Travers. I'm an occupational therapist by background, and I was part of the Darzi 8 cohort. Since then, I've been working across adult social care and health. I initially was a head of service across adult social care, but also overseeing quite some integrated teams with health colleagues. And then for the last 2 years, I've been a change manager looking at doing transformation across social care in Bexley. So I've done quite a lot of work as an OT, and I think I've been working for about 15 to 18 years as an occupational therapist, had kids. So I was working part-time, being a mum, and just got to a point where I felt like I was ready to branch into something else. I didn't ever think that I'd be in management or leadership. So I used to sit as an OT and I used to say, oh, it would be so much better if we just got rid of all of those managers and we could just do our thing. And that was the sort of person that I was. Like, I just loved doing my job. But I kind of hit a point where I just thought, I was just a bit itching for something new. My kids were getting a bit older, and I ended up in a job as an allied health professional lead. And they were then recruiting for a Darzi Fellow, and actually spoke to me and suggested it might be something I'd be interested in looking at. So I then went for the Darzi Fellowship without really knowing what I was doing and what it was about. But just kind of went for it. It was just kind of a bit of an alignment of the right time for me.
What did you do with your Darzi year?
So in my Darzi year, I was working in the London Borough of Bexley, and I was looking at doing a project around sort of evidencing the impact of the community health provision. So looking at outcome measures, measuring the impact. So that was predominantly what I was doing, but also just having great times, just kind of linking with lots of different teams and just trying to understand how they work, what was important to them, but also what motivated them to do the job that they did, and how I could use that motivation to explore looking at different ways of working rather than sort of being stuck in very traditional ways of working, but working with the healthcare professionals to just explore what is their purpose and their reason for getting out of bed, coming to work, and working with local people, and actually what it is that motivates them and what's the changes that they want to see.
What did you find when you asked them that? What do you think that purpose was?
I think most people, actually, when you got to it, they were really motivated when you started talking about local people and about, they had so much pride in what they could offer, and they're always frustrated that they wanted to do more, but they didn't have the resources to do more. So it was always like, well, how do we maximise what you can do with what we've got? So, and I think sometimes it's dealing with the reality of there isn't this unending flow of finances to be able to just do more of the same, but it takes creativity and innovation to think of new ways of doing things. But by helping them to understand that and unlock some of that, help them to really formulate ideas. So it was almost an element of acceptance that we are in sort of quite challenging financial times, but also then motivating them to explore, so what could be different and how could we maximise what we do and really evidence that.
So that's really interesting. I'm hearing quite a difference between the pre-Darzi Deb and the post-Darzi Deb. So there was this pre-Darzi Deb who was saying managers, leadership, oh, we don't need any of that. And suddenly, like post-fellowship, we're talking about shared purpose, motivating people, bringing teams together.
So it was a recognition, but actually there's a different way of leading, and it doesn't need to be from this kind of top position. And actually you get loads of leaders all across the place. You know, it's a lot, often it's the healthcare assistants or the social care assistants that are actually really like pushing for change. Yes.
So I'm hearing something there about new leadership structures and distributed leadership, not just old power hierarchies and command and control. Is that fair?
Mm. Yeah, definitely. And I think that it was recognizing that actually some of my natural attributes could be used in leadership, that element of empathy and kind of put myself in someone else's position. How would I feel if I was in their shoes? What is it that's really challenging them or motivating them? And so that kind of recognition of those natural abilities that you can have or you can develop that can also then support change to happen was quite exciting for me. And I love just chatting to, local people, patients, service users, citizens, residents, just chatting and finding out what's important to them. And I think that's when it puts everything into perspective. And if you can bring other people into those conversations, it's exciting. So I found that actually one of the biggest benefits for me was just that ability to be a bit of a connector, just bringing people together. Or I know someone who's interested in that. Let me bring them together with you. Let's see what can happen that way.
What I'm hearing is that you realised the huge benefit in breaking people out of their silos and bringing people together to have those conversations about what's important. So that's the first thing. And secondly, by doing the fellowship, you perhaps were able to develop the skills that you had in you already and what you enjoyed doing. And you learned how to apply that to bring those people together.
I think absolutely. Like I hadn't really realised that leadership didn't need to be that top-down approach, that it could be different. So the Darzi Fellowship opened my eyes to kind of seeing actually there's a totally different way. And it's about, often I sort of see myself as I love to just bring people together, and it's who want to go in a similar direction and go like, look, actually, I think we're all kind of aligned in where we're going to want to go. Let's just bring us together. And it's almost a bit of a sort of pointing the way about what you're hearing people saying. So let's just give it a go. So I'm currently working in adult social care, but looking at how Statutory Care Act assessments can be done in a different way. So at the moment, it's generally people are referred into adult social care who assess a person for their care and support needs. But we know a lot of people have existing relationships with individuals across communities. And through those relationships, can we look at much more personalised ways that people's care and support needs can be met? So it's less about more traditional services, but more, what's going on across our communities that you're linked in with and those people are linked in with. And that might be the more meaningful way that their support needs can be met to enable them to live the life they want to lead.
There's something there about working with and strengthening cross-sector relationships between all of these disparate services in a complex system, which does sound very complex, to better focus on the needs of populations.
Absolutely. So through the conversations we've had over the last few years, these organisations have come together and said, actually, we want to work together. So they've got so many options to also look at really early prevention and support for people with health conditions as well, or just in their normal, their ageing, their frailty pathway, how people can be supported. They're also looking at doing similar things with home care providers, reablement providers, and had conversations as well with housing providers about how we can do that, that same change.
What do you think you took from your Darzi Fellowship that has helped you to facilitate that change?
I think the power of relationships. I think recognising that you have to come together, you have to co-design things together with people. But actually what I tend to do, the most powerful thing, the last 6 months have been quite challenged because we've just, we've started up a contract with these third sector providers, and it's been a interesting ride the last 6 months. But we've just been meeting weekly, just virtually, to just talk how things are going, not massive set agendas, not necessarily me facilitating that, but having that kind of open space to just discuss, to challenge, to reflect, and keep learning together. And that's been actually quite powerful. I think one of the things that sticks in my mind a lot is that change happens at the pace of relationship development. And I think that's really, really important. And to recognise also the power balances that are going on, and to constantly be conscious of that in that space and aware of that and open about it and talk about it. And the other thing that probably is the most important thing is, and one of my biggest reflections that I think needs more of is making sure that we're always engaging with the local community. Because I think if local people are saying this is how we want, they don't know the difference between whether it's a healthcare worker or a social care worker coming to them, whether it's the charity or not. They just know, they just want to have a conversation and explore what options are, and be treated like with dignity and respect and valued in how their understanding of how they want to live their life. If we continually try and do this only thinking about our own services and the way that we do things, I don't think you'll ever really make the change. So we've got to constantly be going back to what is it local people are saying to us, and how can we hear their voices more? How can they be part of this conversation with us? How can they come on this journey with us?
So there's all those relationships that you need to maintain, but actually one of the most important relationships is between the professionals and the service users, isn't it? And it's maintaining that relationship as well, and always making sure you're focusing on their needs.
Yeah. And I think it's not always myself or the person in that kind of more formalised health or care role that necessarily needs to be the one to do that. What I'm finding is actually the people that have the existing relationships are the ones that we're asking to do some of this work. They're probably the best people in the position to build those relationships up with the public. But then I need to ensure that people listen to those perspectives and hear those voices, and they are valued and they are part of the way that we really hear what local people are saying.
I think that's so important and so valuable and so insightful. Deb, thank you so much for talking to me today. I think if there's a phrase that I'm going to pick out of this conversation that I'm going to take with me, it's that change happens at the pace of relationships. I really love that idea, because it's what I see happen time and time again.
It's great to look at these things in theory, but the reality often is that you're challenging people who have had pride in the way that they've done things for years, and you're suddenly saying, actually, I'm not sure if this is the right place for this work to happen. So where we're saying to social care workers, actually, the people with the relationships aren't you, they're those people over here. That means we need to shift the work and the resources across to these people to enable them to do the work. And that is really tough, which is why I think it's so important to make sure we're magnifying the voices of local people with health, mental health conditions, to be able to say, this is how we want our care and support needs to be met. This is how we want our healthcare provision to be done.
Deb, thank you so much for talking to me. It's been an absolute pleasure hearing everything you've got to say. It was so insightful, and I've got a lot to go away and think about. So thank you very much, and enjoy the rest of your day.
You're welcome. Thank you so much.
Thank you.